A lecture on fluid and electrolyte balance, chapter 43. This is Anatomy and Physiology 250. We're going to start by talking about the interrelationship of fluid and electrolyte balance. So fluid and electrolyte balance and implies homeostasis. So homeostasis is balance in your body, and fluids and electrolytes coordinate with each other to actually maintain that balance. So electrolytes have chemical bonds that allow dissociation into ions. So ions carry an electrical charge. This is critical to fluid balance. And so an electrolyte is something that can be broken down by water into ions. So it has positive and negative. And so that's an important point to know what an electrolyte is. Electrolytes can be broken down into ions, positive and not negative, broken down by water. And then fluid balance and electrolyte balance are interdependent. So let's look at total body water. The fluid content of the human body ranges from 45% to 75% of its total weight. Fluid content varies according to age, gender, weight, and fat content of the body. Now you have to understand the body fluid compartments. You have two major compartments: extracellular fluid. As the name says, it's fluid outside of a cell. And then you have intracellular fluid. That's fluid inside of a cell. Now, in extracellular fluid, that consists mainly of plasma and interstitial fluid. Plasma, as you know, is the fluid portion of blood. Interstitial fluid is the fluid that bathes cells. So that's the fluid that's around the cells, but it's not in the blood. So then we have some others that are lymph, cerebral spinal fluid. That's all considered extracellular fluid as well. But the main components of extracellular fluid are plasma and interstitial fluid. Then you have intracellular fluid, and so that's where it facilitates intracellular chemical reactions that maintain life. So by volume, intracellular fluid inside a cell, is the largest body fluid compartment. Okay. So now we look at the distribution. This just says that this yellow portion is 66% of all the fluid in our bodies, and that's intracellular fluid. And this other 34% is extracellular fluid. Of that, this portion of that 34% is interstitial fluid. That's the fluid that surrounds the cell. This portion is plasma. That's in the blood. And these are the others, the lymph and the other fluids that's in the body. This is just representation. If this is a cell, then the fluid inside is intracellular fluid. And then the fluid outside is the extracellular fluid. Okay, extracellular versus intracellular fluids. So plasma and interstitial fluid, both of those are in the extracellular fluid compartment. So plasma and interstitial fluid are in the extracellular fluid, and they're almost identical in chemical makeup, as opposed to the intracellular fluid inside the cell is different from these two that are in the extracellular fluid. So let's look at the differences between the extracellular fluids. So we're going to look at blood and interstitial fluid. Blood contains a slightly larger total of ions than the interstitial fluid does. So functionally important difference between blood and interstitial fluid. Blood has an appreciable amount of protein ions, whereas interstitial fluid hardly has any. So that's an important difference. Blood, which plasma is the fluid portion of blood, has a lot of protein. Interstitial fluid doesn't have much protein at all. Other than that, plasma and interstitial fluids have the same chemical components. Let's see, we won't worry about this. Electrolyte reactivity. Now look at the avenues by which water enters and leaves the body. So water enters the body via the digestive tract. You drink and eat water. So water leaves the body via 4 exits. It leaves as urine from the kidneys. It leaves as water and expired air through the lungs. Leaves as sweat through the skin. It leaves as feces from the intestine. Here's some general principles of fluid balance. Cardinal principle, the main principle, fluid balance can be maintained only if intake equals output. So there's mechanisms available to adjust the output and intake to maintain that fluid balance. So the most rapid fluid balance mechanisms are those for controlling water movement between fluid compartments of the body. So here's some mechanisms that maintain homeostasis, or balance of total fluid volume. Under normal conditions, homeostasis of total water volume is maintained or restored primarily by adjusting urine volume and secondarily by fluid intake. So you adjust how much you urinate or retain water. That's the quickest way to adjust fluid balance. And then fluid intake is how you ultimately will balance fluid volume. So regulation of fluid intake. A decrease in fluid intake causes increased secretion of antidiuretic hormone. So it's important for you to understand what antidiuretic actually means. Anti is against, diuretic or diuresis is urination. So antidiuretic means that it will keep you from urinating. It helps you to retain water. And then osmolar receptors located in the thirst center that cause you to be thirsty, want to drink more. And then we won't really get into the third ventricle and paraventricular uh, nuclei. Okay, here's homeostasis of total volume uh, of body water. So you have start off normal, and then some factor causes a shift in that total body water. So you can have excessive sweating, you can have diarrhea, you can have vomiting, and so you end up decreasing the total volume of body water. That decreases the secretion of saliva, decreases urination, causes dry mouth, you feel thirsty. Then you increase your fluid intake, and that will have a tendency to restore normal total volume of body water. So urine volume is determined by 2 factors. First is glomerular filtration rate. So except in abnormal conditions, that stays fairly consistent or constant. So depends on how much you drink, you have a certain amount that you'll actually, the kidneys will filter out and you urinate. And then you have the rate of tubular reabsorption of water. That will fluctuate, depends on the needs and whether you want, the body will say to retain water and or to let water leave out. And then we know that water follows sodium, and so this goes through the one of the regulation systems that I'm not going to ask questions on for you. I'm not going to just know that ADH is antidiuretic hormone, so that will keep you from uh, urinating. Okay, factors that alter fluid loss under abnormal conditions. So Rate of respiration, volume of sweat secreted may alter the fluid output under certain abnormal conditions. Vomiting, diarrhea, intestinal drainage. They can produce fluid and electrolyte imbalances. Symptoms range from simple thirst to muscle weakness and kidney failure. This is what we call the law of capillaries. It's good to understand this because actually I'll have a couple questions on this. So if you understand this, you should be able to work through this. So law of capillaries, a control mechanism for water exchange between plasma and interstitial fluid. Remember, both of these are, we're talking about in the extracellular fluid. Both of these are extracellular fluid. So we're looking at between plasma and interstitial fluid. So this mechanism consists of 4 types of pressure. To understand these types of pressure, first you have blood hydrostatic pressure. Hydrostatic pressure is like the blood pressure. And so it's the pressure that's trying to push water out of a blood vessel. Okay? So this is hydrostatic pressure is the pressure that's trying to push blood out of the vessel or from wherever it is. So with blood hydrostatic pressure, it's trying to push fluid out. And then you have blood colloid osmotic pressure. Colloid means protein, and so osmotic pressure is the amount of pressure that is this protein's trying to pull back in. So if it's blood colloid osmotic pressure, that means in the blood you have a certain amount of protein is trying to pull water back to it. So that's on one side of the capillary membrane. And then on the other side, on the interstitial fluid side, you have interstitial fluid hydrostatic pressure. That's the pressure in the interstitial fluid that's trying to push fluid back into the blood. And then you have interstitial colloid osmotic pressure. That's proteins in the interstitial fluid that's trying to draw fluid from the blood into the interstitial space, interstitial fluid. So two of the pressures produce a vector in one direction. So two of these are trying to push blood out of the capillaries, or I'm sorry, trying to push fluid out of the capillaries, and the other two are trying to push fluid back into the capillaries. So the ones that are trying to push fluid out of the capillaries is blood hydrostatic pressures, trying to push fluid out of the capillaries, and then interstitial fluid colloid osmotic pressure. So that's in the interstitial fluid, you have proteins that are trying to pull fluid from the capillaries. So those two work in the same direction. And these other two work in the opposite direction. You have blood colloid osmotic pressure. That's protein in the blood that's trying to pull water into the capillaries. And then you have interstitial fluid hydrostatic pressure. That's in the interstitial fluid. It's pressure trying to push fluid into the capillaries. So those two work together. It's good to go over this, and on page 1005, it has a diagram that talks about the capillaries and the extracellular fluid and the interstitial fluid and plasma and the capillaries. And so it kind of describes these different pressures and how they work. Okay. So these are just equations. Yeah, I just have to know what these are. This is blood hydrostatic pressure, and this is interstitial fluid colloid osmotic pressure. The colloid is protein. So in the interstitial fluid, you have a certain amount of protein. It's going to try to pull water to it. Blood hydrostatic pressure is pressure in the blood that's trying to push fluid out of the capillaries. So these two are working together. And so when these two forces equal interstitial fluid hydrostatic pressure, that's the pressure in the interstitial fluid that's trying to push water back into the capillaries. And then you have blood colloid osmotic pressure. That's where the protein that's in the blood is trying to draw water to it. So both of these are trying to get fluid into the capillary. So what this is if the force is trying to get fluid into the capillaries is equal to the forces that are trying to get fluid out of the capillaries, if they're equal, then you have no net transfer of water. And then each one of those goes from net transfer of fluid occurs when this side does not equal this side, and then fluid shifts out of the blood into the interstitial fluid whenever these two are greater than these two, and then fluid shifts out of the interstitial fluid into the blood whenever these two are less than these two. Okay, so now then we have edema. So edema is a classic example of fluid imbalance. Defined as the presence of abnormally large amounts of fluid in the intercellular tissue spaces of the body. So in that interstitial fluid, that space around the cells, we have fluid that floats around in there abnormally. And so retention of electrolytes in extracellular fluid causes increased capillary blood pressure, decreased concentration of plasma proteins, which are normally retained in the blood, which ultimately causes fluid to stay in the interstitial space more than normal, and you get what they call edema. This is pitting edema. This is where, see how puffy the foot is? If you took your fingers and pressed into this, then you would get this where it did not come back up easily. And that's just fluid in the interstitial space. It's pitting edema. So you can have different mechanisms of edema formation. You have some factor, whatever factor it is, but it increases blood volume. So you have increased blood volume. That means that the blood hydrostatic pressure will increase. That means you have more pressure trying to push fluid into the interstitial space outside of the capillaries. Once you get that, then you'll have fluid that stays in the interstitial space and edema. You can have inflammation, which means that sometimes the capillaries increase permeability with inflammation. What happens then is you lose blood proteins that go from the blood, and the protein goes into the interstitial fluid. Now you have retaining water in the interstitial fluid as opposed to retaining water in the blood itself. What happens is the blood colloid osmotic pressure decreases. Once again, you have more fluid that goes into the interstitial space, which causes edema. And then with burns, you can have loss of blood proteins from within the burned area, decreased blood colloid osmotic pressure, and retention of water in the interstitial tissue. Okay? So regulation of water and electrolytes in intracellular fluid. So plasma membrane plays a critical role in the regulation of intracellular fluid composition. So you have a plasma membrane that separates the inside from the outside of a cell. Now, interstitial fluid and intracellular fluid, hydrostatic and colloid pressures regulate water transfers between the extracellular fluid and intracellular fluid. Colloid osmotic pressure is the chief regulator of water transfer across all membranes, directly related to the electrolyte concentration gradients maintained across cell membranes. What this is saying is, when we talked before, we talked about plasma, and then we talked about interstitial fluid. Now we're talking about interstitial fluid and intercellular fluid and the differences between the protein on the inside, protein on the outside, and the various ions between the inside and outside. So this is saying this is a cell. So this is the intracellular space with the intracellular fluid. This is the extracellular space. This is the extracellular fluid. And saying that if you have proteins, large molecules like proteins can't get out of the cell, but water can. So if you have high proteins in here, then water is going to come into the intracellular fluid to try to dilute out those proteins. So the way that our bodies regulate, because it doesn't let proteins in and out, but it regulates by transferring ions. So now if everything's at equilibrium and then you take sodium out of the cell, then water will follow and water will leave out of the cell to follow the sodium. So how that does that is because it goes against the concentration gradient. We actually will send sodium on one side or the other, depends on if we need water outside or water inside. So what we use what they call a sodium potassium pump. That is active transport. It uses energy to pump sodium out if you needed to have more water out. So you use that's often so that the potassium is linked with it. Every time you pump sodium out, you pump potassium in. So you use a sodium potassium pump to pump the sodium whichever way that you want the water to go. So let's say if you needed more water in the extracellular space, then the cell would pump out sodium, pump in potassium, and water would flow out from the inside the cell to the outside. Okay. So normal sodium concentration in the interstitial fluid, and then the potassium concentration in the intercellular fluid depends on various factors, especially the amount of ADH. ADH is antidiuretic hormone. So ADH is antidiuretic. That means it does not, it causes you not to actually urinate, and it will help you retain water. Then if you stop the antidiuretic, then you will start to urinate more, so you urinate out more water. And then the kidneys are considered the chief regulator of sodium levels. And so they're chief regulator of sodium levels. Thereby, they're the chief regulator of fluid levels. And then chloride ions generally are excreted in the urine in association with potassium. And chloride is needed as well. And actually, we talked about different ions and they're needed. So chloride or chlorine ions are involved in the production of stomach acid. That's where you have hydrochloric acid. So the chloride ions are actually used as well to help develop hydrochloric acid. Okay, and they talk about hypocalcemia, kalemia, and potassium. So then they talk about in the book the different fluid imbalances, fluid volume excess, electrolyte imbalances, and that's where we start talking about some of the different ions. So in the book, let's see, I think that's it for this. But in the book, they talk about different ions. So I do want you to know a few ions that are important, like know what the most abundant extracellular cation is. Cation means positive, and of course that is sodium. And then know how do you keep the potassium ion concentration inside the cells? Well, that's maintained by a sodium potassium pump. Remember the pump I said that pumps sodium out and pumps potassium in at the same time? So that maintains the sodium levels and the potassium levels. And actually that's on there as well, what the sodium potassium pump does. And the chlorine ions, know that use that in stomach acid. Know when the sodium balance in the human body is considered electrolyte balance. Keep a balance of the electrolytes with sodium balance. And know what an electrolyte is. Know that electrolyte dissociates into ions when placed in water. And actually, this one, just know in general that an acid is a chemical that dissociates in water and releases a hydrogen ion. So when you talk about acids, think of hydrogen ions. So anything that will be broken up by water and release hydrogen, that's considered an acid. Know the different compartments. Know that intracellular fluid and interstitial fluid and plasma. Those are the three main components. Intracellular fluid, interstitial fluid, and plasma. Know the forces of hydrostatic pressure. Okay. And actually, when they talk about in the book, and didn't go over in the PowerPoint too much, but know what hypertonic fluids are and hypotonic. Hypertonic is when you have a high concentration, and hypotonic is when you have a low concentration. So if you have a cell in a hypertonic solution, that means it has a higher concentration of protein or ions in the solution. And so in the cell will take water from inside the cell outside of the cell to try to dilute out the hypertonic solution. And then just know hypotonic. If you have a hypotonic fluid, and then like you have a cell and it's in a hypotonic, that means it has less concentration of substances in it, then water will flow from the, the solution around the cell into the cell. Okay? So it will go into the cell to try to dilute out the cell. And then we talk about the different portals of exit for water. And so you have urination, you can have through defecation, so diarrhea, that's where water will leave. And sometimes that's what we call sensible water loss. You actually know when you have to urinate. You know when you're having a bowel movement, it's liquidy. You know if you spit, you know if you sweat. You can tell, you can see that. We call that sensible water loss. And sometimes you'll actually not even realize that you're actually putting water out, and that's like when you talk. When you talk, the air that comes from your lungs is moist. It has a lot of moisture with it, and so that's called insensible water loss. You don't even recognize it. It's called insensible water loss. And then know what causes you to get thirsty. And it's like high osmolarity in the plasma, high concentration in the plasma. It's not diluted out. That will cause you to be thirsty. And know what decreased volume or increased concentration of substances in the extracellular fluid is defined as dehydration. Know the definition of dehydration. And I mentioned actually they mentioned calcium ions, but just know where calcium ions are stored in our bodies. You know, calcium, what makes up uh, you know, our bones are made up of calcium. So our bones are the storage area for calcium. So I actually put that in there. That's bones are considered osseous tissue. So calcium is stored in osseous tissue. Know that. Uh, uh, and so know that blood has a much higher protein content than interstitial fluid. And like I said, know what antidiuretic hormone will actually do, and know what edema is, excess accumulation of interstitial fluid. Know the main systems that's responsible for water loss from the body. And of course, we all know that's the urinary system. And then know where most of the fluid is stored in our bodies. Most of the fluid is stored in the intracellular compartment. And then know the uh, osmotic pressure gradient tends to push, uh, tends to pull water towards it. If you have higher osmotic pressure, like so you have colloid osmotic pressure, the higher it is, it tries to pull water towards it. Okay. All right. So that's the main things with that one. And next, I'm going to talk about the endocrine. Okay, and also for the quiz, I'm going to give you 5 extra credit points, and that's on extra credit questions from chapter 26, talking about the endocrine glands. And so, you know, their endocrine is because they do not have ducts and they release their substances or hormones into the bloodstream. And so it has an effect wherever the blood goes. But what I want you to know as well is that they have each hormone that's released has specific target cells. And so the target cell, even though it goes anywhere in the body, only the cells that have receptors, which those hormones can bind to. And so know that the hormones go anywhere that the blood goes, they go in the bloodstream, but they only affect the target cells that have receptors where the hormones can bind. Okay, there's a question on that. And then also, I want you to know that the hypothalamus has hormones that cause they're like releasing hormones and inhibiting hormones. And so you can look on page 579. It talks about the different hormones. I'm not going to ask you specific names for the hormones. But on page 579, table 26.1, it just gives you an idea saying that the hypothalamus releases hormones that are makes hormones that have releasing and inhibiting characteristics. And so look at that table. And then also on page 590, 591, I want you to look at table 26.5 and look at what uh, insulin does, where it's made, what it does, and also glucagon, where it's made, what it does. Know that from table 26.5. And then go to page 593, table 26.6. Look at the testes, what it produces, uh, the hormones that testes produce. So you're looking at testosterone. And let's see, 3. There's a lot of them there, but look at the testes produce the testosterone, and look at what the ovaries produce. So you have the estrogen and progesterone. So on page 593, table 26.6, know testes and ovaries, what they produce and what they do. Okay, then we're going to go to 596. 596, that's table 26.7, and look at some of the conditions there and know what hypothyroidism, what it is, and what hyperthyroidism is. And then so hypo and hyperthyroidism. Okay. All right. I think that's it. That's the 5. So the 5 extra credit from chapter 26. So know that target cells have receptors to which hormones bind, and know that the hypothalamus makes hormones that are releasing and inhibiting hormones. And then those different tables know, what the ovaries and the testes produce, and what they produce and what effect they have. And then that's table 26.6, and then 26.5. Insulin and glucagon, where they're made and what effects each of those has. And then table 26.7, hypothyroidism and the signs and symptoms, and what it is that is secreted, and hyperthyroidism. So hypothyroidism, hyperthyroidism. All right, you all do well. All right, we'll see you soon.